Pharmacy is essential to the hospital because we are how medications are acquired for the whole system. So every single medication that's given to a patient in the hospital comes through your primary hospital pharmacy. I feel like I was meant to be a pharmacist. We get to focus on one thing and we can make a real difference in the quality of a patient's care by focusing on that one thing. And if you're looking at the entire picture, sometimes you miss that one thing that could actually really impact the greater picture.
A pharmacy buyer keeps account of all the medications in the hospital, and then if we need any, I purchase that for the facility. So I can buy anywhere from something as cheap as an aspirin to something that would cost the same as a car or more.
It's really busy in the pharmacy. A lot of times, you might fill 100 plus prescriptions a day. And so usually you have a lot going on, and that's kind of, it fits my personality well to stay busy and to help people. It's very detail oriented. So you really got to fill everything exactly so. It's kind of like almost following a recipe. I like to bake, I like to cook. So you follow these steps and you get this outcome, and I feel like that was something that I really thrived in that environment.
As a pharmacy buyer, you either have to be a nurse. Critical access hospitals can hire nurses to be buyers, or you can take a program called PharmTech, and a pharmacy technician can also be trained in buying and helping the pharmacist.
In high school or right out of high school, you can certainly be a pharmacy clerk, but it'd probably be a good idea to go ahead and take the test and complete the certification to be a certified pharmacy technician. And then you could kind of see if you like that, and there's a career there, then you could also see if that's something that you really like, if you want to go on to get your undergraduate degree or your Doctor of Pharmacy degree. To be a pharmacist, you have to now complete the Doctor of Pharmacy program at a certified location.
I don't necessarily do direct patient care anymore, but I still help people by trying to find the lowest cost of any medication for them. It's kind of like ultra shopping in a way. It kind of feels that, but it also is, I know I'm helping other people by making sure they have the medications they need.
As a pharmacy technician, they're actually expanding what they can do in many states, including Kansas. And so pharmacy technicians can immunize. You have to complete the requirements for these things, but it's becoming even more exciting to be a pharmacy technician because there's so much more that you can do in the pharmacy than even whenever I was in a retail pharmacy. So that's expanded in just the last few years. The other thing is if you're a pharmacy technician, there's lots of different spaces that you can operate. And so being in a hospital, it's different than what it looks like in a community-based pharmacy. So you can be a pharmacy buyer, you can deal with a lot of automation, you can talk to patients and get med histories on them. So really there's lots of different things that you can do with that license, even if it's not your traditional, what you think of when you see the pharmacy technician at your local pharmacy.
As a pharmacy buyer, some things that you need to have an interest in is organizational skills, some math, pretty simple math. I always tell people, yeah, I get to do kindergarten math. I can count to 10 or 20 or 100, but you count a lot in pharmacy. Process improvement, or what is the quickest way I can do this? Lots of things like that happen in pharmacy because you want to keep your costs down. So how best can I keep my costs down? How effective can I make things? So if you're interested in that kind of thing, pharmacy is good for that.
If you think you might be interested in going into healthcare because you think health and health care is interesting just in general, pharmacy is a great way to go because you're on the healthcare team. You get to look at labs and you get to see the medications and the different disease states. It's a lot of behind the scenes work. Sometimes you're the unsung hero. So if that is something that appeals to you and you like doing things just so, then a career in pharmacy might be a good choice for you.
If you're thinking about looking into pharmacy, I would reach out to your local pharmacist. I would go spend a day with them. Just check it out, see what it's about. It appeals to lots of different aspects. If you're strong in science, it appeals that way because it can go down to the molecular level. It's strong in math because you do math all the time with dosage calculations and stuff like that. So if you like math, that's good. It's strong in organizational skills because you have to be organized in the pharmacy to know what you need and what you need to get in. Kind of has a very broad appeal. And honestly, if I was a high school kid, I really wish somebody would have just even said something about it because I think it would have sparked my interest.
I love my job. I can't imagine doing anything else. Being in particularly the hospital pharmacy, I think is what I was meant to do.